My name is Nicole Korp, and I am one of the program associates here at the School-Based Health Alliance, and we're going to get started right on time. I know some are still trickling through, but we have a lot to get through today, so let's get started. We're the School-Based Health Alliance, and we work to improve the health of children and youth by advancing and advocating for school-based healthcare. We believe that all children and adolescents deserve to thrive, but too many struggle because they lack access to healthcare services. School-based healthcare is the solution, bringing healthcare to where students already spend the majority of their time in school. When health and education come together, great things happen. Attendance improves, conditions like asthma or diabetes are better managed, behavioral health issues get quick, expert attention, and we all know that healthy students make better learners. So for today, none of our facilitators and planning team have anything or financial relationships to disclose. And just a reminder, we are providing continuing education credits. And so this is provided through a partnership with Community Health Center, Inc. and Weitzman Institute. So they are available for the following list. And there will be an evaluation that we will be posting during the last 15 minutes of our presentation. So it will be shared in the chat box, and attendees must complete the evaluation in order to receive your continuing education credits. And the certificates of completion and CEs will be sent once the entire spring and summer series is complete. So that is in August. And just a reminder, you have until 9 a.m. Eastern time tomorrow to complete your evaluation. Just a few reminders, all attendees are in listen-only mode. And we want to encourage you to please use the chat to have conversations. When using the chat, please select all panelists and attendees before typing the message, just to ensure that everyone can see and be a part of the conversation. And we do offer closed captioning. And so in order to turn this on, please click the CEC button at the bottom of your screen. And just a reminder that this session is being recorded. Our objectives today are to ensure that student reentry to schools with appropriate, or to ensure student reentry to schools with appropriate mental health supports. Understand the importance of school partnerships to assess and address the mental health needs of all students in and out of school-based health centers, and to address school staff, provider, and administrator secondary traumatic stress. Now, it is my pleasure to introduce our two amazing speakers for today. So first we have Caitlin Werner, who is a licensed professional counselor and earned her master's in counseling at Asbury Theological Seminary and her bachelor's in healthcare administration at the University of Central Florida. She is a trust-based relational intervention practitioner, and she is trained in several evidence-based practices, including trauma-focused cognitive behavioral therapy and acceptance and commitment therapy. She is passionate about providing quality mental health care to children, adolescents, and families in underserved communities. Since joining the health center, she has continued her passion in educating others on working with children with trauma through leading professional development seminars in her school district, as well as taking part in educational webinars with the health center. Secondly, we have Bila Salafu, and she is a youth project intern for the School-Based Health Alliance and the Play to Prevent Project, a member of the School-Based Health Alliance Youth Advisory Council, and she's a freshman at George Washington University. Bila has been involved with local hospitals, mentoring youth through Army education, and promoting cultural awareness through her language immersion experiences. At GWU, she studies global health in hopes to understand how to improve healthcare discrepancies. After college, Bila plans to attend graduate school to further her work in mental health and substance misuse disorders amongst youth populations. So I will turn it over to you both.
Thank you, Nicole, for that introduction. I want to start by thanking you all for being here today and for the hard work you're doing to care for these students during these unprecedented times. As we jump in, I wanted to ask you to do a quick favor for us. As we're presenting today, it would help us to get an idea of who we're talking to. So if you don't mind, could you go ahead and put in the chat box what you do and what your role is? Are you a teacher, a behavioral health provider, administrator, and so on? That would be really helpful for us so we have an idea of who's with us today. And while you do that, I would love to just take a minute to recognize that this past year, so much more has been asked of providers, of teachers, administration, and students than we could have ever prepared for. If you're here today, I'm guessing it's because you both recognize this, as well as the tremendous need that our students are having during this time. We're going to spend the next hour today looking at how we as a community of providers, teachers, administrators, and safe adults can come together to support students. This pandemic has continued to be ongoing and traumatic for our students as well, so we want to work together to provide the best care we can, and I'm grateful for your willingness to be here and to walk with us through that. So we're going to jump in. Thank you guys so much for adding all of these in the chat. It's great to see so many people here and from so many different states represented. We're going to jump in first by talking about how COVID has become this collective trauma. I'm sure a lot of you have heard this before, and it's a term you're familiar with, but we know that COVID-19 has been dramatic and had devastating impacts for everyone in this country. From death of loved ones, financial instability, job loss, childcare crisis, school closures, fear and anxiety of becoming ill. It's been pretty drastic for most people. And while no two families and no two children have had the same storm of stressors, we have all gone through this shared traumatic experience. And when that happens, it's referred to as a collective trauma. Just over a year ago, when students' lives literally changed almost overnight. And I remember then a lot of students thinking this will be a 2-week thing, and then it will be just through summer. And then it continued on, obviously, to where we're at now. And they fought season of change after change, stressor after stressor for over a year. And many schools have had different models of learning, from being fully in to fully remote to a hybrid of the two. Some schools have changed their models on and off as the year has gone on to meet the needs of the community, students, and teachers. And while we as adults know that those changes needed to happen, for many students, change is just a huge stressor and can be really unsettling. And with all of that combined, it brought on a lot of different mental health struggles for the kids. If you're in schools with students, you've probably been seeing a lot of these already. From social isolation to the breakdown of usual routine and structure, family stress. I remember having a student even tell me that the people she used to look up to and rely on are the ones now breaking down all around her. We've had schools closures and openings, then closings again, to hybrid, financial instabilities at home, disruption in clubs and sports and things kids did where they found their support and their coping skills. A study from the University of Arkansas came out saying 38% of families skipped meals or didn't have enough money to buy food in March 2020. In 2019, that number was 10.5%. And there have been a lot of studies that have come out talking about how ER visits for mental health reasons have gone up dramatically. It's now 24% from ages 5 to 11 and 31% for ages 12 to 17. And I'm sure all of these things are things you've probably heard about or read about. Some of these might be things you've experienced or watched students you care about experience. And while on their own, they're hard enough and can cause trauma, I go back to it's been happening for over a year. And that brings a new experience level to this. Oftentimes in the field, we talk about this thing called chronic toxic stress. The longevity of COVID has led it to move into this prolonged or chronic category. It's often defined as stress where someone experienced strong, frequent, or prolonged adversity. You may hear it when people talk about children living in neglect situations or things like foster care. But as researchers are starting to look at what the big picture of COVID has caused for a lot of our students, they're looking at how it's become this chronic, prolonged season, and it's causing some of the same impacts that other chronic stress conditions cause. When we live in that, when students or we live in that chronic stress, we start living in survival mode. Our brains start being flooded with stress hormones, and it doesn't leave time for our body to recover. Research has shown that exposure to the stress of living in fight or flight mode and all those stress hormones constantly dumping in the brain can have long-term impacts on children and their development. There's 5 main areas that research usually looks at when they talk about what living in chronic stress does to a child. I'm also a huge research nerd, so stuff like this I love, and so just bear with me if you don't love research as much as I do, but I think it's been important as I've worked with students to look at how these different areas of impact has really continued to worsen, or I've seen in students who maybe didn't struggle as much before COVID. But the first area of impact is our brains. Our brains are these fascinating things. They're constantly growing and changing and developing. We're creating new pathways all throughout our life. And because this happens, we know that what we go through and what kids experience impacts their brain development. So children living in chronic or toxic stress or undergoing trauma, their brains develop differently than other children. There are tons of research out there where they take pictures and images of kids who grew up in orphanages versus kids who grew up in safe homes, and you can see the difference in their brain development. And if these experiences, if these traumas go unprocessed, the new pathways and connections around those experiences become created and strengthened over time. The good news and the hope, and that part of what I love about this field, is we also know that brains can heal as well. That with the right intentional interventions, with good care, with safe adults, their new pathways can be created, and there are hope for kids who are struggling. Often when I talk about and teach on the brain and how it relates to trauma, I usually just start with the basics. I usually talk about, the upper and the lower part of the brain. The upper part of our brain is the part of our brain that learns. It's where we make decisions. It's what teachers are hoping to access during school. And then our lower part of our brain, or sometimes people say the reptilian part of our brain, that's where we kind of live in our survival mode, right? The fight, flight, or freeze. And when we're going through trauma or living in that stress, we're living in that lower part of our brain, where our body is constantly thinking it's in danger and it's sending that signal out to the rest of our body. And when you've lived in that chronic stress for so long, you sometimes don't even notice your body is still in that spot because it's almost become so normal. And your brain gets stuck in this fear. It becomes flooded with stress hormones, and it cannot maintain and develop at the same time the way it would be if you weren't in that state. Now, our upper brain, instead, at this age of the kids we're serving, it's developing so quickly. They're trying to make good decisions. They're trying to access it. And when they're living in this trauma or the stress state, they just can't get to it. They get stuck and they're unable to grow the way other kids might be able to develop. And so we know that we need to, as adults, kind of help and move into some of those areas. Otherwise, their brain will develop differently and they'll be stuck there. Another main area where chronic toxic stress can impact a child is their body. Research continues to show that the impact of living in stress puts you at higher risk for things like developing cardiovascular or sleep or intestinal problems, along with many other physical problems. And so by addressing the stress, we're hoping to hopefully help our children be physically healthier as well. It also impacts our biology. We know that trauma has the ability to impact us on a cellular level. There's been a lot of research about this in the past few years, that our organs and tissues are impacted when we're living in chronic stress or in traumatic situations. One of my favorite books that I've read recently on this is called It Didn't Start With You. that talks about generational trauma and how it impacts on a cellular level. So if you do like research, I definitely recommend that one. Another area that trauma and living in chronic stress can impact is our belief system. I find this one really fascinating because our belief system is usually developed by two different ways. It's developed by the words we hear and the experiences we have. And so we know that kids who experience trauma often develop beliefs about themselves or the world based on those experiences. One of my favorite ways I've seen this talked about or taught is that we usually come into the world believing three things. We believe that I'm a person of value, that the world is fair and good, and that adults are safe. And then when trauma or chronic stress enters a child's story, those views often get changed. They start to struggle with believing they are no longer a person of value, that the world is no longer fair, safe, or good, and that adults cannot be trusted. And so as I was thinking about how has COVID impacted kids' belief systems, and do I see any overlaps with that, I started looking at, well, how have I seen it impact how kids feel about themselves as a person of value? And in this last year, I've seen a lot of kids struggling with self-confidence, with social skills, and with understanding their world in general. I sat with students who began to feel hopeless to the point they've started to consider suicide. I sat with other kids who've expressed feelings of worthlessness or being unlovable as they couldn't make sense of this past year, and their support groups had changed so dramatically. Some of those social isolation pieces took away places where kids felt connected and cared for and felt like they understood who they were in the sense of this world, which is such a challenge for kids in general and a part of their development. But throw in a pandemic and they can't have the same supports and outlets that they used to have, they start to really question and struggle. When I think about how they feel their world has changed and if it's still safe and fair, I've watched kids walk through different levels of fear of getting sick, of family members getting sick, of being responsible for their family members getting sick, fear of losing things that they love, things that make them feel like themselves, whether it's friendships, sports, school, watching them just adapt to this whole different model of school than any of us walked through, and ask them adapt to different expectations than that we as adults have struggled with as we've tried to work from home or learn what that looks like. And they haven't necessarily had the space yet to process it because we're still in the middle of it. And then I think about the piece where adults cannot be trusted. I think about how they've watched so many different adults in their life walk through COVID and handle things differently, and not sure who to trust and how to make sense of it, from struggling with having, maybe they have a family member at home who's very cautious and they see other people not cautious. I often think about videos I've seen that have gone viral of kids telling people to wear their mask. Like I remember one specific little boy in Walmart telling someone to wear their mask, and it becomes this thing where they're not sure who to trust and what to do, and they're hearing so many mixed things they don't know where to go from that. So I think as I look at this, COVID has impacted their belief system. No one thought they were going to be in this year, and a lot has changed for them. And again, they haven't had the space to process it yet, because even as adults, we haven't had the space to really process it yet. I think a lot of times we're still working to figure out how to live in the midst of this, how to care for our own families, how to care for the students in our care, that there's just a lot of struggle there. And then behavior. Kids have been showing more and more behavioral issues recently. It's been interesting. So I work in Connecticut and my school has been hybrid since the beginning of the year, and we're moving to full-time within the next couple of weeks. And it's been interesting to watch trends in behavior over this past year. I work in a school that has been known to have some of the highest behavioral issues in Connecticut, for like the Connecticut region. We have the highest crisis call rate. And I kind of love it. Like, I just love working with these kids. It's something I adore. It's a really good fit for me, but it's been interesting to watch trends over this past year. So I thought I'd share a couple that I've seen. And so as you're going back into schools, or if you're in school, you might relate to some of them or might give you some ideas of what's coming. First thing I noticed is a lot of kind of my biggest behavior kids, parents kept them home initially. I think a lot of times it was stressful, the idea of sending them back to school and not knowing, are they going to keep their mask on? Are they going to listen? Are they going to be able to handle school being so different? And now these kids are re-entering and coming back 5 days a week after not being in school at all. A lot of them feel way behind. They feel isolated from their peers. Their teachers feel stretched and disconnected from them. And we're seeing a lot of behaviors increase. And then we had some of our kids who did come initially that struggled with behaviors that did really well in the hybrid model because class sizes were small. It was quieter in the rooms. There was less stimulus around them. And now we're reintegrating students and their class went from 4 or 5 kids to 18 to 20 kids. And it's a lot. I remember our first day of that, it literally felt like putting out fires all day long. And so I think it's been hard for kids to know they got to experience what learning was like on a smaller classroom level, and they were feeling successful in some ways. And now they're struggling and they don't have the words or ability to even name what it is, and it's coming out in their behaviors. And then we've also seen a lot of kids who never had behavioral issues before having them. Again, they're under so much stress and under new circumstances, and they may not have the words to share. I know there's a common phrase we hear in the field that says behavior is the language of those who have no voice. And I think in this process, kids who maybe have shown the ability to have a voice before, they still just, again, don't have the language or don't have the space yet to explain what this pandemic has done to them and for their life. And so they don't know necessarily how to process it or tell adults who are also still processing it. And that's one of the reasons I'm so glad that Viola is here today and willing to share with us, because she is a student who has lived through this and she's walked through it with friends. And I think it's amazing that she's agreed to share her experience and her story with us, because I know that we can really learn a lot from what she's gone through. So with that, I'm going to let her share for a little bit.
Thank you, Caitlin. I think that I can speak for all youth and say that the pandemic has definitely impacted our mental health and our lifestyle and all of the things that we used to do, we can't do anymore. So it's definitely been an adjustment. My experience has not been ideal because I was supposed to be a freshman on my college campus and have that freshman experience that everyone talks about and raves about, but my school ended up closing up. And I found it really difficult to balance what my family still expected of me and being home and then having to also have college coursework on top of that. So I was seeing a lot of my friends and the people around me have their college experiences because their schools were open up, and couldn't help but I was feeling like I was missing out on my own. And of course there was the isolation. So you lose that that social contact that really helps you overcome a lot of things. And then mental health struggles came with that. So it has definitely been a challenge. And I also have a sister who is in high school, and her experience as well has been really difficult trying to take all of her coursework on Zoom University. That's what we call it. But one thing that I will say is that myself and her, we had to really take the initiative to take care of our mental health and make that a priority for ourselves, even though grades are important. If you're not in that mental space to actually want to do your work, then you can't really do anything. So we really had to take advantage of the resources that my school offered. Thankfully, I was fortunate enough to have a school that had a lot of mental health resources and a lot of workshop and a lot of tools that a lot of students actually use to make the experience better, despite the fact that it was on the computer. It made it feel like a community. But the thing is, a lot of current struggles, like Caitlin defined, have like that a lot of people had faced before had become amplified because of the pandemic. So for most youth and their families, this was really true, with financial burdens becoming even worse, food insecurity increasing, and like I said, mental health struggles ultimately becoming much, much worse. So fortunately, there are ways to help youth and their families overcome these struggles, which Caitlin and I will be discussing in the next slide.
So I think if you're like me, one of my initial thoughts was like, well, what can I do? Like, what can I help? Because we have the normal things we do in our jobs, but what specific things can I do amidst COVID and these kids coming back to school in such a vulnerable place? And I think schools have made huge leaps, and if you're here, you know this, and becoming more and more trauma informed. And they're letting us start to talk about and have these conversations more about trauma and what it looks like and how we can figure it out in schools. And so I think knowing what to look for, knowing what trauma looks like in kids, and helping staff and teachers and other adults around you also know that can be helpful. I think, again, research has shown that we don't know the long-term effects of COVID yet on kids' mental health. We're starting to get clues, but we still don't know the whole picture. And many psychologists and researchers are predicting that kids with prior mental health conditions will struggle more, and that kids living in poverty will also struggle more. And those are often where our school-based health centers are. And so knowing that the need is going to be high, and knowing kind of how do we help identify the kids that need the support. Another factor that research has found is that the biggest driver in how kids are functioning is how the parents are functioning. And so we know that we need to support families. I know, at least in my experience in school-based, sometimes connecting with families can be a really hard piece. And it's always something we've known as a really needed piece. And so as we continue to do our work, knowing that our families need support too, not only are their kids struggling, which as a parent is hard to watch your child struggle, but they're struggling too. And they're probably more maxed out after this year than they've probably been in a while. And so how do we walk beside families in that? Another big thing is expectations. I love the Brene Brown quote that that expectations are resentments waiting to happen. I think knowing what to expect when we go back into school, and as we're having children come back in, will help put us in the right place as the caring, safe adults we want to be. This has not been a normal situation for students, for families, for staff, and they were being asked to do things they've never done before. And so I think about this last year and some of the things I've noticed, and hopefully some things that will help you with your expectations as you go in, is kids are struggling more. They just are, and they're burnt out from struggling for so much for so long. Kids and their families, they're more irritable and emotional. I know what that has looked like for me is a lot of times we end up holding a lot of that for the families we work with, right? Like we come in as an empathetic listening ear, and they've been holding a lot for a long time and they're ready to give it up. So we end up holding a lot of that. And then regression is commonly reported for these kids. Behaviors that they've maybe made huge leaps in, they're now back to really struggling with again, or things they felt like they worked through, they're now back to really needing to reprocess and come back to. And so I think as we know that, we can kind of have ourselves in a place to be ready to support that. So when the kid that has been the best kid in class is now, turning over desks, we're not like scared and freaked out like we're the adults who can get it, because their parents are going to be scared and freaked out. They're going to be scared and freaked out. So how do we kind of help hold space for those kids? And then also social anxiety has been a lot higher in the students I've worked with. I remember kids who already had it working with them. They're like, but how do I make friends? Now they're wearing masks. I can't even read their facial expressions. Like I can't even know if they want me to talk to them or not. But you're telling me I have to go introduce myself now and like try to talk to these kids, and our desks are awkwardly apart. We're not eating in the cafeteria. So I think that has been a big change as well, and helping kids kind of work through expectations even around some of those social pieces.
Yeah, so some of the ways that I found to also be beneficial for youth in general, encouraging healthy habits, creating a safe space, and shifting the focus to prioritize mental health. So when it comes to healthy habits, I know that a lot of the stressors with youth create this idea of like not knowing how to cope effectively, and then it creates this cycle of going down the road of having negative coping strategies and mechanisms and not emphasizing and practicing self-care. So encouraging those healthy habits, what does that consist of? Finding your own personal way of coping and practicing self-care again, and allowing you to have that sense of self-discovery when it comes to finding their own ways to cope, like I said. um, so with my school, what they did was, like I said, they brought out a lot of tools and resources, and they had like mini workshops that you could go to around like 7 o'clock. So after all of your classes, and a lot of them were great because they had a lot to do with health and fitness, and they even had like yoga, and there was also salsa classes. So it was just a really fun way to take the light off the load, and um, kind of put your attention on recreational things. And the other thing down here, creating space, extending that helping hand. So I think the main issue with youth is not feeling comfortable or safe enough to say something. And just by saying like, I'm here to help, you can always come to me with your problems, that makes such a difference, because a lot of times we don't want to say anything, we don't want to be vulnerable and put our experiences out there, but knowing that someone wants to listen is really, really important. So just little phrases like that really help. And lastly, prioritizing mental health, shifting the focus from getting good grades or things that really are secondhand, in my personal opinion, because like I said before, if you're not in the right space mentally to do your work, like you're not going to want to do anything anyway. So definitely prioritizing that self-care and those coping strategies, because in the long run they increase academic success, because not only are they right within themselves, but they're going to be excited to do the things, the work, and they're going to have that right approach to actually engage, to actually be a part of class discussions and things like that. So, especially at this point in time where everyone is sort of isolated and alone, definitely prioritizing the self-care and the coping mechanisms and the mental health definitely helps, and trickles down like sort of a domino effect with all of the lesser important things that affect youth. So I will turn it over back to Caitlin.
So part of what I was thinking about is as we identify needs of the students, like as we're looking at, okay, we know they're in this tough space, we know the things they're struggling with, we want to help, like what are some things that they need that we can also then help provide in the school? And so I think the biggest one is connection. Research has shown that the number one predictor in how children fare after traumatic events is the presence of a safe adult. If you haven't heard that term safe adult before, it's something that I'm really passionate about because it's something that has shown to be so important for kids. It goes back to a lot of our attachment to adults, right? And to caregivers. And we never get to know how long we get to be safe adults in a child's life. But I think as we are here, we're probably all passionate about like, how can we do this the best we can while we have these children in front of us? And so we know that children feel safe, grow, and thrive when they have connection. We know that connection fosters resilience and it builds self-confidence. We also know that the kids we work with, we don't really know what their connection is like at home. We hope for our kids that they have safe adults they live with. That would be the ideal situation. And we want to work with families to help them be safe adults for the kids in their home. But we don't always know. And so two things I'm sure you're aware of is even for the kids we know that do have those safe adults, we know the families again are exhausted, fighting one crisis to the next, one new big decision for their family to the next to try to navigate COVID. And so sometimes right now, home life might not be rainbows and butterflies and puzzles and baking, but it's stress and fighting and distance and pushing each other's buttons, kind of some of the worst of ourselves that come out with stress. And so they need safe adults sometimes, like we can partner with the families by being those safe adults too for the kids, even when the parents are also struggling. And then I know this with my caseload, and I'm sure you know it with yours as well, is that some of these kids we serve, home is not always the most safe or nurturing environment. And oftentimes with COVID, they've been spending a lot more time there and haven't necessarily had the outlets or the breaks that have been helpful to them in the past. And so the more that we're able to provide connection through other avenues, a lot of times when I teach teachers about connecting with kids, we talk about there are simple things we can do that help a child feel seen, right? Like giving eye contact, more than when they're just in trouble, or more than when we're just trying to correct some type of homework, asking them what they think and feel about situations, matching their behavior. There are simple little things we can start to do to help kids feel more and more connected when they're needing it more in this environment. The second is kind of building this idea of helping kids feel safe or felt safety. Again, we know kids are scared right now, scared of getting sick, being the reason others get sick, scared their world has changed, their friend circle has changed, scared they might not move up to the next grade. And so that a lot of them end up living in that lower part of their brain. And so part of us helping them move to the upper part of the brain is to create an environment where they feel safe. And that's what I mean when I say felt safety. We can tell kids they're safe now and that school is doing everything to make them safe, but unless they feel it, they're stuck kind of in their lower part of their brain. So we can tell them, but they need to feel it. And we know that kids feel safe when there's things like predictability, whether that's in their schedule and routine, whether that's within their relationship with the adults. They know what to expect from their teacher, what's expected from them. They know what to expect from you. That helps bring around the feelings of safety. And then also creating their structure and routine in their school environment so that they know what's expected. And the last thing is finding ways to play. We know that kids learn through play. It opens the brainstem. It helps them connect. I always love the research that says you can tell a kid the same thing like 100 times, but you tell them it through play like 12. I don't remember the exact numbers. And they tend to get it quicker because we know their brains just work better. And so finding ways to play. And I even think with kids, I've been doing a lot of groups over telehealth, and they always want to do a game because they've missed playing with their friends. They've missed playing with adults. Like that's something that's not necessarily been a huge part of their life lately. And yet it's such an important stage of their development. Finding ways to kind of reincorporate that into their school day would be helpful as we move forward with kids. And so as I look at that, I think about kind of the next piece I want to talk about, and that's how do we partner well with schools? I think school partnerships is one of the most exciting parts of our job as school-based health centers. It's something that is really fulfilling for me personally, and part of why I got into this work is getting to work with these schools, right? Because we as school-based providers often have a different lens that we get to bring to the table, a different training that we get to bring to the table to work with these teachers and staff who are already giving and caring so much. And so one of the first things that I've seen be really helpful in school districts is if they're open to it, offering trainings and professional development. What I hear a lot from teachers is that their trauma-informed trainings often are very basic information on what trauma is. And that's kind of the same one they get every year. And they talk usually about kind of those big T traumas. So like, the sexual abuse, the physical abuse, witnessing domestic violence, but they often lack information on what can they actually do and how to help in the classroom. They are missing specific strategies and things that they can take away from that training and integrate into their classroom. And so I think as providers who are in school and we see it, we watch it, being able to offer specific things that teachers can do in the classroom can be really helpful. One of the ones I work with a lot with teachers is encouraging and teaching whole class interventions. We know kids with trauma, right? Their brain is different. They need different interventions. But oftentimes teachers say, well, I don't know who has trauma and who doesn't. The interesting thing with COVID is like right now we know that in some ways everyone does. And so that question is gone for teachers. But even before COVID, I would talk to them about, well, you don't know, right? So how can we offer these strategies to the whole class that will help every kid with or without trauma? And then it also provides a lot of dignity to the kids who do have trauma because they're not necessarily singled out. And so one of the things we would talk about is teaching self-regulation skills to the whole class. Some people do sensory breaks for that. Go Noodle's a really popular one. My school currently that I'm in, they do mindful moments during the morning announcements every morning. And they'll do meditations or things along that line. They also have put calming corners in the different classrooms over this last year. That's been something we've worked with our PTA to help fund and get into the classroom. A lot of times I will work with teachers to teach different breathing techniques, whether it's volcano breath, or there's one I do magic mustache, and they've even had me come in and like we'll do it with the whole class during their morning meeting time. Another part I try to work on is using intentional language when I talk with teachers. And whether it's in 504 meetings or IEPs, talking about being aware and just talking about what the child is going through the trauma lens can help kind of inform the way we're thinking and looking at the kids we're working with. A couple of the strategies I use, I try to use teacher language when I do this. Like, I'm not a teacher. I have so much respect for teachers because that is a job I would never be able to do. But I like having lots of friends who are teachers. I've learned like, okay, if I talk about how it relates to the child's ability to learn, that's what they're passionate and care about, right? So if I can phrase some of how the trauma is impacting their ability to learn, that can help relate it back to something the teachers can understand, talking about how they're living in their lower brain and how do we get them to their upper brain. I also use a lot of mantras. The two that people at my school would tell you I use a lot is like escalated adults cannot de-escalate children. And so really talking about that self-care piece and that knowing like when you're kind of at a spot where you maybe need to walk away. And then I talk a lot about shifting our thinking from what is wrong with this child to what has happened to this child. And then I work really hard to validate the teacher's experience and feelings as they're kind of working with some of these hard kids. Because again, like we're working in these districts with kids who are hurting and they're struggling with it too, right? Like we don't walk away from not being impacted from that. Which leads me to our next topic, and that is talking about secondary traumatic stress. You may have heard it referred to as compassion fatigue or vicarious trauma. And essentially, it's defined as the emotional duress that comes when individuals hear about firsthand trauma or experiences of another. According to the National Child Traumatic Stress Network, 6 to 26% of therapists, 50% of child welfare workers are at high risk for secondary traumatic stress or related conditions of PTSD or vicarious trauma. Those at higher risk are often women, people who are highly empathetic, individuals with unresolved personal trauma, people carrying heavy caseloads of working with traumatized children, people who feel socially or organizationally isolated, which we have a lot of social isolation going on right now, and people who feel professionally compromised, meaning being asked to treat and do things maybe outside what they feel comfortable and skilled at. Oftentimes awareness about secondary traumatic stress is key in starting to address this and provide treatment for it. Because I don't know about you guys, but when I was in grad school, first walking into this field, this wasn't something we talked a whole lot about. We knew that we were going into carrying emotionally heavy stories, but I don't know that I knew the amount of stress and the impact doing some of this could have. And now that I'm over a decade in, I definitely have a bigger understanding. Individuals and organizational efforts often together create the best outcomes in caring for us as providers and teachers and admins that are working with these kids and these stories. So some of the warning signs, I think it's important just to know as you're walking through this, so you can help maybe identify if it's something you're struggling with, or maybe if you know coworkers who are struggling. A lot of times it looks like PTSD. People struggle with feelings of isolation, anxiety, depression. They might be having poor sleep. They might have changes in appetite. A lot of times you see it at work when it comes out when you're maybe trying to avoid a certain client or student. You're not returning phone calls. Maybe you're having trouble making decisions, feeling emotionally exhausted, dreading certain cases or clients, or feeling very numb, or on the other extreme, hypersensitive to things happening in the media or events. You almost get to a point where you're just so emotionally exhausted that you're beginning, again, to have PTSD-like symptoms. One of the things that as you work to identify this in yourself, it's helpful to sometimes look at this list and pick out the top 3 that you think you would struggle with the most, and then kind of do a check-in, like, where am I on these? If maybe it's a green, like I'm healthy, I'm doing well, like these are my top 3, but I'm actually in a good place. Or maybe it's a yellow, like, well, these are my top 3. I see that they're starting to be a little bit harder for me. Or maybe it's a red, like, man, I'm really struggling. Like I'm not necessarily in the best place I can be. So in the next slide, we'll talk about what are some strategies for prevention and intervention. The first part is, again, like organizational intervention and individual intervention is the best, but as an individual first, like how do we start to recognize this in ourselves? And so first, being aware of secondary traumatic stress, finding life balance, right? That work-life balance, which can be really difficult. Using some of the relaxation techniques that we know and help other people with all the time, but actually integrating and using them in our own life. Finding ways to express yourself, whether it's journaling or art or other ways that you can kind of help get out your experiences. Sometimes people in our field need some help with assertiveness training, learning to say no, learning to put up those boundaries. I think as helpers, that could be something we really struggle with. Building a support system. I think for me, it's been healthy to have people in my field that get it, and then also people outside my field, so I'm not constantly talking about work all the time. Figuring out what your self-care strategies are. Seeing a therapist can be really helpful. There's no shame in that. And then if you're having any unresolved personal trauma, it puts you at a higher risk. So just working to address that. I mean, I think we know as therapists, we can't take our clients to places we haven't been willing to go ourselves. So working to address that the best you can. And then we'll look at organizationally. First, psychoeducation, right? Like sometimes people at the top of our organizations are removed from the day-to-day clinical work. They're not in it all the time, and it can be something that they don't really get what you're facing with. So educating them on what it's like, educating them on secondary traumatic stress, with the goal of hopefully moving the organization to a culture that normalizes the effect of this. That it's accepted, they acknowledge the stressful conditions we're working in, they work to help balance caseload, not only numbers, but sometimes trauma, and balancing how many cases do you have that are high trauma versus other cases. Self-report assessments have been helpful in some organizations, using flex time scheduling, so being able to take time off when you need to or flex your time. A self-care buddy system, somebody who can maybe know your warning signs, know your top 3 and check in with you. and making sure that you have adequate time off, because we need that time to be able to recover. Some of the specific interventions that research has found, there hasn't been a ton of research on this, but CBT and mindfulness has shown so far to be the most helpful in treating secondary traumatic stress. Again, going back to that caseload management can be huge, and kind of being aware of what your cases are like, ongoing training so you feel more professionally confident. Reflective supervision is one that in my years of working has been really helpful, is to have a supervisor who allows you to talk about what it's like for you as a provider in that working with the kids you're working with, and kind of processing out some of how it's impacting your life. Peer supervision can be helpful too when a supervisor might not be the right fit for that role. Again, taking time off or seeing an outside therapist can also be really helpful. So now, if you guys have any questions, we'd love to for you to enter in the chat box so that we can address them. Again, we're just so grateful that you're here and that you're doing the work you're doing. We know that it's not easy, but we wouldn't be able to serve these kids well without you. So we are really grateful you're here. I would love to answer any questions you might have.
So our first question here in the chat is, do you have a sample self-care assessment?
So I have one, but it was one, so I worked internationally for a while. And so it's written more towards the international work I was doing, but I'm sure I can find a few and we can get them sent along to you, because I don't know that that one would relate super well, but I could probably reword some of it. So absolutely.
It's a really good question. Good resource. Do we have any other questions?
I see a question about other things we have to share, resources. I mean, I like read a lot and have lots of things I could share. Is there anything, Tammy, that you would be looking for, or anyone specifically? Like, I do think, Nicole, maybe we could share what Byla wrote, her article as well, because I think it shares well from more about kind of her story and what it's been like to walk through this. And feel free, if you're listening and you have resources, you can feel free to post them in the chat as well.
So we have another question. How are you utilizing TBRI in your school?
That's a great question. I love talking about TBRI. So far I've been able to, this happened more last year before COVID hit. I was able to do a couple of the TBRI trainings with classroom teachers, which was great. I started, so TBRI has these groups called nurture groups, and I had started a few of those with girls, one with girls and one with boys in our school, and that has gone really well. The kids love them. We still try to do them over Zoom, although it's a lot different. And I think, again, a lot of it goes back to TBRI, or trust-based relational intervention, if you're not familiar with it, has really shifted. Going through that training shifted and informs my practice a lot. So a lot of how I work with parents, how I work with students, looking at attachment needs of children with trauma has been really helpful.
Do we have any final questions? I think if there are no other questions, I think it's okay for us to to wrap up, again, the CE evaluation link is in the chat. Before you go, though, we just wanted to highlight a couple other offerings that BILA is also involved in with our Youth Advisory Council. We have a Save the Day for our Be the Change Youth Training Program. We also, coming up on May 20th, we have a Cut the Cameras Utilizing Media to talk about unhealthy relationships with young people. So we have two of our Youth Advisory Council members, as well as Anna Gasalme from Novelly, presenting on issues. I'm so sorry. Oh no, I went a little too far. But we also, we will be sharing all of this in the PowerPoint as well. We also have a, I will be sending the blog that is, that BILA wrote that Caitlin mentioned with the PDF of all of that. So thank you so much for attending our webinar. We're very excited to have you guys on, and thank you so much to Caitlin and BILA.